Number 9. Customer 12. Infant presents with cardiac failure. There are multiple focal lesions in liver which shows peripheral flow and curve Doppler. Diagnosis: hemangioendothelioma. Question 13. What is true about hepatic MRI? Patch apparent sequence help in visualizing intrahepatic bile ducts. Question number 14. The pregnant woman presents with abdominal pain. There is ascites and non-visualization of middle and left hepatic veins and improving cava. Diagnosis: Budd-Chiari syndrome. 15. Woman presents with breast mass or horizontal cystic mass with an internal solid component. Diagnosis: papillary carcinoma of the breast. See, it's like this. Patient presents with breast mass or horizontal cystic mass with internal solid component. Which are then most common pre-malignant liver tumor in less than 4-year-old child is hepatoblastoma. 4 years old hepatoblastoma, and it shows congenital cardiac failure. In 5-year-old child with epidemic focal lesion in liver, diagnosed hepatoblastoma. And in hemangioendotheliosarcoma, there must be congenital heart failure history. 16. A lactating female patient presents with painful lump. Would be diagnostic aspiration. C. 17. Female presents with well-defined oval-shaped breast lump with type 1 and hand with curve. Diagnosis: fibroadenoma. 18. What is characteristic of hemangioma of bone course trabeculae? 19. Giant cell tumor resembles which entirely require logically and pathologically individual bone cells. 20. A lesion is described as being lucent with sclerotic margins. This effectively rules out even sarcoma. 21. Parent has evidence of ectopic soft tissue calcification. There is reduced serum calcium and phosphaturia on exogenous parathyroid administration. Diagnosis: pseudohypoparathyroidism. What is pseudohypoparathyroidism? It is an organ resistance to parathyroid hormone. So there is reduced serum calcium and phosphaturia. Phosphate released in urine. No reduced reduction in secondary hyperparathyroidism with end organ resistance. Okay. In secondary hyperparathyroidism, there is no reduction of serum calcium. No reduction in secondary end organ resistance. 22. There is aggressive looking lesion in clavicle of pain with history of chemo and radiozygote lymphoma, most likely diagnosed osteosarcoma. 23. A parent presents with history of trauma. Duodenum appears thickened with increased renal wall. Diagnosis: duodenal hematoma. 24. Ultrasound to endometrial mass, pulsatility and resistive index were mentioned. Diagnosis: endometrial carcinoma. Pulsatility is decreased and resistive index are increased. 25. Ultrasound to mass in the vagina with stalk which shows flow on Doppler. Diagnosis: a vaginal polyp. 26. Various associations were mentioned and related to general tract. Question asked which association was true: Hutch diverticulum and barilar outlet obstruction, Hutch and VUR. Question asked which was true about genitourinary tract anomalies: electron microscopy of megareader, there is aganglionosis. 28. Question about anatomy of truss of prostate. Corpora amnesty are present between transitions and peripheral zone. 29. Question about posterior ultrasound. Fish hook appearance of ureters seen in benign prostatic hyperplasia. There is J-shaped ureters. Fish hook ureters are seen in BPS or J-shaped ureters. 30. Scenario of pulmonary gangrene. 31. Scenario of pelvic cyst. 22. Which agent is used for renal scintigraphy in patients with poor renal function and shows good activity with reduced radiation dose? MAC3 is used in renal scintigraphy. In multicystic plastic kidney, MAC3 shows decreased function. So DTPA is used in dynamic function of kidney, and DMSA is used for split renal function. 33. A diabetic patient goes into shock after administration of contrast agent. What can be the cause? Lactic acidosis. 34. What is the best investigation for 10 mm size adrenal mass? Dynamic CT. 35. What feature does not favor true lumen or fast lumen? All are correct. Cobweb sign, bird beak sign, increased attenuation, contrast, opacification, all do not favor true lumen or fast lumen. Thoracic pain present with pulmonary edema after aortic valve replacement cause hyperthermia toxicity. Third scenario about amiodarone effect in lung. Interstitial fibrosis. Amiodarone causes interstitial fibrosis in lung. 38. What is the most likely cause of permanent predators in a 1-week-old baby? Acute respiratory distress syndrome or meconium aspiration. The non-just actually of a premature infant will infiltrate diagnosed alien membrane disease. 40 such actors will have hyperventilation with medicinal shift, congenital lobe emphysema. 41. There is linear opacity in the right lung on chest X-ray which is extending below diaphragm. This is a final component of this syndrome, Stimchar syndrome. 42. Soft tissue mass below carina, bronchogenic cyst. 43. Which feature indicates irretractability of bronchogenic carcinoma, involvement of vessels. 44. Medially deviated on X-ray IVU, retroperitoneal fibrosis. 45. Question about suitability of various endoscopic and GI disease, MRI for pelvic tumor staging. 46. Magic angle artifact seen which muscle rotator cuff, supraspinatus. Which muscle of rotator cuff shows magic angle artifact, supraspinatus. 47. Scenario about cardiac body tumor. 48. Which features characteristic of angiofibroma, intraoral peteruga beta and fossa. 49. Scenario of Sjogren syndrome. 50. Increased uptake on thyroid scan. Is seen in Graves, Hashimoto's subacute thyroiditis. 51. IVU shows multiple filling defects in ureter and bladder in diabetic patient diagnosed malakoplakia. 52. Infection associated with which type of renal stone? Strovite calculi. With urine-spreading bacteria, protease, Pseudomonas, Staphylococcus, Klebsiella, and Mycoplasma. 53. Scenario for cystic mass with nodule and posterior fossa, astrocytoma in children, and angioblastoma in adults. 54. Fracture of petrous bone with sensory hearing loss. What is likely to be seen on CT? Includo-stapedial joint dislocation. 45. CT scan shows hemorrhage in parietal bone lobe likely cause trauma with meningeal artery involved. 46. Cystic lesion isolates to CSF in all sequences with restriction on TWI epidermoid. 57. Characteristic of primary vulnonar synovitis low on all sequences. Low on T1, T2, and GRD, variable enhancement, and high on STIR. Plus or also Bloom artifact, PVNS. Is 58. Renal transplant patient with lung nodules having halo sign, invasive aspergillosis, and immunocompromised patient. 59. Which is the cause of renal cortical necrosis? Reverse frame sign is also seen in renal cortical necrosis. Causes of acute cortical necrosis are severe hemodynamic shock, traumatic blood loss, postpartum hemorrhage, septic shock, venom toxin, transfusion reaction, severe dehydration, microangiopathic hemolysis, hemolytic uremic syndrome, and renal transplantation. 60. Scenario about focal renal atrophy. 61. Scenario of bucket anal tear, horizontal meniscal disease. 62. Scenario about Osgood-Schindler disease, football player, seen in football player. 63. A parent presents a history of diarrhea and over-enthusiastic house of surgeon administered hypertonic saline rapidly, diagnosed central pontine melanosis. 64. Which sign is seen in cerebral venous thrombosis, empty-dental sign on CCT. 65. Head artery shows hypertonation without definable wall with a central vessel, central acinar emphysema. Hypertonation without definable wall with a central vessel, central acinar emphysema. 66. Which is the commonest site of arteriosclerosis in lower limb? Popliteal artery. Common at bifurcation of a popliteal artery. 67. Patient with myocardial infarction, MRI will show T2 hyperintensity because of edema and fat. 68. How to differentiate the caecal pumping volvulus, how straw is maintained in caecal volvulus. 69. Mass in posterior stomach wall and which structure? Pancreas or lesser side, pancreas. Mass in posterior stomach wall in which structure? Pancreas. If there is not an option, there will be gastroduodenal artery. After gastric ulcer rupture of stomach, it may involve gastroduodenal artery. 70. Scenario about chordoma, expansile lytic destructive midline mass in sacrum. 71. Scenario about incomplete at higher informed mole. It shows fetal parts and 69 XXY. Complete mole ultrasound shows snowstorm appearance and its genetic is 46XX. MCQs 2015. MCQs 2015. 1. Renal function of kidney is assessed by DMSA. 2. Contrast used in chest soluble fistula is amnioplaxy. 3. Hot lesion in thyroid scan, adenoma. Cold spot is cholestasis. 4. Most common location of benign American breast lesion is outer quadrant. 5. Anatomy of breast or MRI, T1. 6. Pope used for infant brain ultrasound through anterior fontanelle sector. 7. Breast view to see submandibular gland encephalography, oblique lateral view. 8. Hypertension signal T1, T2 signal of bleed on MRI, chronic. 9. Joint walking associated with hyperplastic cerebellar 10. Most common posterior mediastinal mass is neurogenic tumor or a neuroenteric cyst. 10. Also in unilateral perennial paralysis, we do AP. Look here. Best way to see a submarinal gland in scalography is oblique lateral. Sorry. Best way to see submarinal gland in scalography is AP view. AP view. Also in unilateral perennial paralysis, we use AP view. See. In B view, that is oblique view, lateral view, it will see submarinal duct to project stone away from teeth. To see stone, we do oblique lateral view, submarinal gland sonography, and to see submarinal gland, we do AP view. 11. Iron for thyroid, iron 1, 2, 3. 12. Base for modern film is polyester. 13. Emulsion of film along with several crystals, majority are halide. 13 is bromide, majority are bromide. 9% bromide, iodine 10%. 14. Apical fibrosing not seen in asbestosis. 15. Calcification lung is seen in which infection? Chickenpox. 16. Stress factor is best seen in MRI stir. 17. The physics CD noise ratio is direct proportional amount of data collected by a detector. 18. Anatomy level of cranial on lateral X-ray, lower border L4. 19. A level of aortic root on CT is BD7. So D4 to D5 is level of aortic root on CT. 20. Sign radiography. A focal spot should be small. 21. Formulators and gamma camera placed close to increase dissection. The parallel hole are commonly used. Collimator and gamma camera parallel hole collimator are commonly used. 22. For better visualization of pancreas, fluid-filled stomach. 23. Classification of radiological procedure, quality assurance. 24. Endocavity lesions seen in site videos, best modality, MRI. 25. Adenomyosis is best seen on MRI. 26. Aortic colon is seen in grave colitis. 27. Segment of liver. Segment 3 is in left lobe of liver. 28. Aliasing is corrected by increasing PRF and increasing angle of ionization. 29. Agent used in cardiac stress test, adenosine inotropic agent is butamine. 30. Cervical spine neural foramina narrowing is best seen on parasagittal. 31. Diaphragmatic opening levels. A esophageal opening is mainly in left side with fibers of right crust covering it. T10. 32. Kinetic energy of fast moving electrons is converted to electromagnetic radiation. Bremsstrahlung. 33. Film field connected compared with calcium tungstate. Aneurysm is region of septum pellucidum, anterior communicating artery. 35. Male child, 3 months, HV plus HN negative, investigation MCUG. 36. Modulating transparent function is a feature of computer radiography. Conventional radiography without plane without screen. Modulating transparent MTF is a feature of conventional radiography plane without screen. 37. Investigation of trace for massive pulmonary embolism, CT angiography. 38. A young female having mobile, well-defined lump in the breast with profound calcification, fibrinoma. 39. Which one is the dynamic procedure? Fluoroscopy. 40. Tube rating charts curves. See below and to the left is safe. 41. Effects of grids. They increase optical density and contrast. 42. Dysphagia is caused by B apparent right subclavian artery. 43. GRE sequence is done to detect intracranial hemorrhage. 44. Binding energy. Energy expanded and removes electron from atom. 45. Atomic number Z refers to number of protons and neutrons. Number of protons A. 46. Regulation of K-15 X-ray system completely controlled by autotransformer. 47. Percentage of adjustment of MES to see change in density A 35%. 46. 47. Put 8 radiant dose given to pregnant lady of 10 mg CT pale growth can cause could not reach to diagnostic range.